Hi, good morning. Good morning. Is this Miss Jenna's house? Yes, this is. All right, well, I am Amrita and I am from the local hospital where you had your surgery a couple of days ago. Is this a good time to come in? Yeah, please, sure, come in. All right, so how have you been, Miss Jenna? Well, nurse, I have been good. I've been fine, but I'm a little bit worried about my, wound ever since the surgery. Oh, all right. You're worried about your wound. Would you mind telling me what exactly are you worried about? Yeah, nurse. I think that I'm not making good recovery so far. Oh, you're not making good recovery. So, why do you say you're not making good recovery, Miss Jenna? Could you please elaborate on that? Yes, nurse. It's just that, I feel that despite, doing so much what the doctor had told me, I have not been seeing any fast recovery. I mean, I still have pain and, my wound is not recovered yet fully. Oh, all right. Well, thank you for your answers, Ms. Jenna. But before we proceed further, I would like to ask you a couple of more questions to understand your overall health better so I can further guide you in recovering faster. May I? Yeah, sure, nurse. All right. So, would you mind telling me if you have been taking enough rest since your operation? No, not really, nurse. Honestly, I have been taking rest, but not so much. I have been carrying out my daily activities and I've been doing a little bit of work as well. Oh, all right. You've been doing a little bit of work. So, what does your daily routine consist of, Miss Jenna? Well, I usually do a little bit of household chores and I've been partially doing my work as well. Oh, all right. Would you mind telling me what do you do for a living? Where do you work? Well, nurse, I actually work as a waitress. Oh, as a waitress. So it must be quite a hectic job because you might have to stand and do a lot of mobility work, right? Yeah, well, nurse, that's the job. All right. And do you still have pain? Yes, nurse, I still have pain. And that's why I think that, whatever antibiotics the doctor gave me, I don't think it's effective at all. Oh, all right. But have you been taking your antibiotics regularly? Yes, nurse, I've been taking them regularly, but now I honestly feel I should not be taking them because I'm not seeing any recovery. Oh, all right, Miss China. Well, I understand why you would say that. So correct me if I'm wrong, but you've told me that so far you believe there is not much recovery on your wound side, and you've been doing a little bit of household activities and partially some of your work, which is a waitress job, and you've been feeling a lot of pain and you find antibiotics to be ineffective. Am I correct, or would you like to add something else to that? Yes, nurse, that is correct. Well, I appreciate your openness to me, so thank you for all the answers, Miss Jenna. Well, based upon all the answers you've given me, I believe that, since you have been doing a little bit of activities here and there, that could possibly be the reason why you haven't seen such a huge recovery. Are you following me, Miss Jenna? Yes, nurse, but do you mean that I'm the one to blame for that? Oh, no, no, I'm not saying you're the one to blame. This is something which can happen to anybody, right? It's an infection. But definitely you can take certain measures which will help you to recover faster. So, can I tell you about those measures? Yeah, sure, nurse. All right, so what I'm going to do is I will tell you certain measures you can take to recover your wound faster, and then I'll tell you other things, some miscellaneous things which might help you in the recovery. May I? Yes, nurse. All right, so the very first thing you need to do is you need to continue taking your antibiotics course regularly. Antibiotics course will only work when you complete the entire course. If you stop it in between, then your body will develop a resistance to antibiotics, which will in turn not affect your body. Do you understand, Miss Jenna? Right, okay. Secondly, I think what you should do is sometimes you can expose your dressing to the sunlight. What it will do for you is it will expose your wound to fresh air, which will help the wound in recovering faster. Okay, would you be able to do that? Yeah, sure, nurse. All right, and lastly, you need to make sure that you rest, you take plenty of rest. Because if you do not take rest, it can further exacerbate your condition. Because I see that you're also a diabetic. And for diabetic patients, it's extremely crucial that you keep your movement slow or pretty much restricted, because the cuts, bruises, injuries, things like these exacerbate very easily for a diabetic person. So, what do you think about that? Yeah, I understand that, nurse, but I really need to go back to work. I'm the only earning member, and I cannot lose on finances. Well, I understand that, Ms. Jenna, it's extremely difficult situation for you since you're the only earning member. Um, that's why I'm telling you, you need to take plenty of rest so you can go back to your job easily as soon as possible. One more thing that I can do for you is, if you're finding it difficult to carry out your daily activities, I can, tell the hospital to send an assistant for you to carry out your chores for you. Would that be okay? Yeah, nurse, I think that would be okay. But what about my job? When can I go back? Well, that's another point. I think what I can do for you is I can get, a medical certificate signed by the doctor, which you can show at your workplace, and you can get paid leaves until you recover faster. So, how do you feel about that? That sounds good, nurse. That sounds good. Yes, Miss Jana. Any other question you have? Yes. How long will it take for me to recover from this? Well, it will take approximately 1 or 2 weeks more, but I would really like to reschedule this meeting again after 1 week. Would that be okay for you? Yeah, sure, nurse. All right. All right, great. So I'll see you next week, and until then, make sure that you follow all the instructions I've told you. All right? Yeah, sure, nurse.